everybody, and welcome to our class on health policy. This class will mostly help you to define what health policy is, to discuss multiple dimensions of the policymaking process, and to explain a policy issue to a lay audience. Policy is essentially a course of action agreed upon by those with the power to execute and enforce it. Now, policies can be private. Organizations have policies, businesses have policies, but we're going to be talking about public policies. Public policies are governmental actions, laws, rules and regulations, and judicial decisions. And their purpose is either allocative, to redistribute resources, or regulatory, to essentially control how different things are accomplished. Now, policy originates as the negotiated preferences of different stakeholders, and we'll talk more about that in the next lecture in this series on policy formulation. So when we talk about public, meaning governmental policy, there's three things to know. The public policies are authoritative decisions. They're made in the legislative, executive, or judicial branches of government, and the whole goal is to influence or direct the actions, behaviors, and decisions of others. Authoritative. So this is the key to understanding public policy. Government policies are authoritative. They're determined and enforced by the government. If policies are not followed, such as laws, people can wind up paying fines or even going to jail. The authority of the U.S. government to make public policy comes from the U.S. Constitution. Now, governmental authority in the United States is broken up into three branches. The legislative branch makes the laws. So that's our Senate and our House of Representatives. The executive branch implements the laws. So the actual carrying out of the law and presenting it to the people is done through federal agencies under the leadership of the U.S. President. And the judicial branch interprets the law and can stop a policy from being implemented a certain way if it's determined that that way is not congruent with our Constitution. Now, in the U.S., we have a system of checks and balances. So the legislative branch writes the laws, confirms presidential appointments. You can spend a little time on this chart and see it. The executive branch can propose laws, but only the legislative branch can pass them. Once a law is passed, it's administered. If somebody in a stakeholder in the U.S. population doesn't like how a law is being implemented or wants it implemented differently, they can challenge that law in the judicial branch. And so the tension between the three is what provides protection for all of us. Now, governmental health policy is defined by the World Health Organization as the decisions, plans, and actions that are undertaken to achieve specific goals within a society. Now, government public policy has two sets of characteristics. The first is the form. What form is the policy in? Is it a law coming from the legislature? Is it a rule or regulation coming from the executive branch, or is it a judicial decision? The second part is the purpose of the policy. Is it allocative or regulatory? So laws are decisions made by legislators that are codified in the statutory language of enacted legislation, and they're made by the legislative branch of government following established procedures, and there's more material on the Blackboard site if you want to dive deeper into that concept. For example, Public Law 89-97 of 1965 established Medicaid and Medicare. Medicaid and Medicare was passed as an amendment to an existing law, the Social Security Act of 1935. President B. Johnson signed it into law on July 30th, 1965, and it's been amended and changed annually since then. And we'll talk more about Medicare and Medicaid in its own session later in this series. Another government law, the Patient Protection and Affordable Care Act, otherwise known as Obamacare, is a law. signed into law on March 23, 2010. Even though we call it Obamacare, President Obama did not pass the law. He requested the law, but the law had to be passed by the House and the Senate, by the U.S. Congress. Government action. So implementation is where the rubber meets the road. The executive branch implements laws through government agencies. I'm not going to go through this whole chart because it's pretty complex, but this chart shows you how the U.S. Department of Health and Human Services is organized, and many of the agencies that implement health laws, such as the Centers for Medicare and Medicaid, the Health Resources and Services Administration, the CDC, the FDA, and so on, are under the umbrella. However, not all health-related agencies exist under Health and Human Services. So the Environmental Protection Agency, the Office of Veterans Affairs, and the U.S. Department of Agriculture heavily affect the public health of the United States, but they don't, organizationally, they're not under Health and Human Services. So once a law is passed, depending on the law, one of these agencies then becomes responsible for implementing it. And implementation starts with the crafting of rules and regulations. So even though a law can be thousands of pages, the Affordable Care Act is almost 3,000 pages, it still doesn't have enough information to implement it. The law is not going to have the form to apply for Medicaid under expansion. The law is not going to have the nitty-gritty details of how to set up an exchange. So once a law is passed, the executive branch agencies have to develop the rules and regulations so that they can implement the law. And these rules and regulations can also take thousands of pages. The rules and regulations are issued via an open public process. For rules that are going to heavily impact stakeholders, there's often a 30 to 180-day notice, and there's public hearings, and stakeholders will be given many opportunities to respond to the rule before it's codified. Once a rule is finalized, it has the force of law. And they're published, the rules and regulations are published in the Federal Register by the executive departments and agencies of the U.S. so that if you wanted to know what the rules and regulations were concerning the implementation of a law, you can find it. It's all in writing. Here is an example of a rule from Medicare. And this is just the summary. If you want to see the whole rule, you can click on the link. And what this rule does is it's revising some regulations concerning how pharmaceuticals can be marketed to people on Medicare. Now, there's also judicial decisions. So when a stakeholder doesn't like a law, rule, or regulation, they can challenge it in the court of law. Court decisions are binding. They can strike down laws and they can change how laws are implemented. For example, in the original Affordable Care Act in 2010 had mandated that all states expand Medicaid to include single adults, people at 133% of poverty level or below, and to include a mandated basket of services. The National Federation of Independent Businesses took the U.S. government to court to challenge this and other mandates in the PPACA. The National Federation of Independent Businesses won that court case, and the Supreme Court ruled that the Medicaid expansion, that mandating the Medicaid expansion was coercive of states, and the federal government was not allowed to mandate Medicaid expansion. The court did allow the federal government to let states choose to opt in, and that is why we still have 10 states that have not expanded Medicaid in the U.S. Okay, now let's talk about allocative policies. Allocative policies distribute a net benefit to some distinct group or class of individuals or organizations. Sometimes this is a distribution, such as Medicare and pensions. All of us, if you get a paycheck, part of that paycheck goes to Medicare. And when we turn 65, or if we opt in early at 62, we will benefit from what we have contributed and from what people are contributing at the time we start. Sometimes this allocation is a redistribution from the wealthier folks to the poorer folks through taxation, such as Medicaid, in order to ensure that some public objective is met. Now, regulatory policies are those policies designed to influence the actions, behaviors, and decisions of others through directive approaches. Now, here are some key allocative health policies: Medicare, Medicaid, Title X funds, HEAL loans, research funding. Those are all examples of allocative policies. Medicare is an allocative policy because it's a public law that's designed to give benefits to the elderly. All workers and employers pay into Medicare through a payroll tax. This funds Medicare Part A, and the money from these taxes is then allocated to benefit a part of the population, the elderly. Regulatory policies have 5 different types. There's market entry restrictions, there's rate and price setting controls, quality controls, market preserving controls, and social regulation. So let's talk about an example of each one. Now, market entry restrictions are really important because they're the restrictions that states use to make sure that people are licensed to do what they say they're going to do. I can't just put out my shingle as Dr. Stacy and start treating patients for diseases. I'm not qualified. It's the market entry restrictions that provide protection. These include licensure for health professionals, scope of practice standards, and certificate of need or programs. Now, the challenge with these is that these are at the state level, and it's because of how our Constitution is designed. The U.S. Constitution specifically states that all powers not directly given to the federal government devolve to the states. And so that's why every state has a different driver's license. That's why if you're a physician or a teacher or a nurse or a licensed professional in one state, you have to get a different license from another state if you go to practice in that state. Now, some states have reciprocity and some don't. Another form of regulatory policy is rate and price setting control. Now, almost all other countries have centralized healthcare systems, and the government regulates the reimbursement rates for medical services and the pricing for healthcare services. The U.S. cannot do this. We can only do it for Medicare and Medicaid because those are the only prices that the U.S. by law can control. So the U.S. doesn't otherwise regulate prices of healthcare or pharmaceuticals, and one example recently is the price of insulin. So in 2018, the price of insulin was significantly higher in the U.S. than in other countries, and it actually had gotten even worse from 2018 to 2022. So an example of how the U.S. could do this is through the Inflation Reduction Act. The U.S. government was able to cap insulin prices for those on Medicare at $35 per month, but it doesn't apply to those who are not on Medicare. And you can look at the change in consumer prices for all other goods, and you can see how insulin was an outlier. Why did the pharmaceuticals charge more? Because they could. Well, in response to the Inflation Reduction Act capping the prices for those on Medicare, several pharmaceutical companies are now voluntarily capping the price on everyone because they see the writing on the wall and they don't want to be regulated. It's not a sudden change of heart. The area of regulatory policy is quality control. So Food and Drug Administration regulations pertain to the safety of drugs and medical devices, and that's an example. This is one of my public health heroes. This is Frances Kelsey. She was an FDA official that saved the USA from a generation of children born with birth defects due to something called thalidomide. Thalidomide was a medicine in the late 50s and early 60s widely used in Europe for morning sickness. It had horrific side effects, and some of the children born to mothers who'd taken thalidomide would be born with deformed arms and feet, with missing organs. It was terrible. But Francis Kelsey single-handedly stood in the way of allowing thalidomide into the United States and of allowing thalidomide to be prescribed for morning sickness. Another area of regulatory policies are market-preserving controls. So antitrust laws in healthcare seek to promote competition, the idea being that if you only have one or two providers of a service, the prices will be higher because there won't be any free market pressure to keep the prices lower. Healthcare doesn't work that way, but we still have antitrust complaints, and most of them in the US have to do with hospitals and the conglomeration of hospitals into larger and larger systems. Finally, we have regulatory policies. Social regulation. Social regulation are what we're used to thinking of as policies. These are laws. Laws are around public safety, workplace safety, environmental pollution, seatbelt laws, helmet laws. These are all social regulation laws. The New York soda size ban is an example of a failed social regulation policy. So New York City attempted to pass a law that would limit the size of soda servings that could be served. And due to rather intensive lobbying on the part of the beverage companies, the law failed. Now, the New York City smoking ban in restaurants and bars is an example of a successful smoking regulation policy. Okay, so this lecture provided a brief overview of what is health policy. One challenge that we didn't really discuss is our deeply rooted cultural preference for limited government in the US. And that preference for limited government makes it difficult to pass laws at the federal level and in many places at the state level pertaining to health services, universal health care. In our next lecture, we'll talk about how health policy is created and the conditions needed for health policy to form.